Hello, doctor. This is your patient. You can start your clinical consultation now.
Good morning, doctor. Hello, good morning. I'm Dr. Maunika. Today I'm asked to examine you and take history from you and address your concerns appropriately. Would that be okay with you?
Yes.
You're Mr. Kevin and you're 56 years old, am I right?
Yes.
Okay. Can you tell me more about the weakness problem you have been experiencing?
I have weakness
Okay. Where exactly can you tell me?
in my arms.
In your arms?
Yeah.
So is it there just in your arms or is it there in any other parts of your body like legs as well?
No, just my arms.
Okay. So when exactly did this problem start?
Maybe a couple of months.
Couple of months.
Yeah.
Is it getting worse since then or is it just the same when it started?
No.
Okay. Do you notice any specific triggers for this weakness?
No.
Okay. Have you tried any medications to relieve that?
No.
Okay. All right. Any difference between day and night? Like, is it worse as the day progresses?
No.
No. Okay. When you say weakness, do you have difficulty lifting up your hands, like when you try to comb your hair?
Yes, I have.
Okay. Is there any difficulty to hold things as well?
No.
No. Okay. All right. Do you have any difficulty to climb up the stairs?
Yes, I do have.
Okay. Do you feel that there is any difficulty to wear your footwear?
No.
Okay. All right. Do you have any other problems apart from weakness, like any blurriness of your vision?
No.
Okay. Have you ever bumped into objects?
Yes.
Okay. Is there you have? Okay. Is there any difficulty to change the lanes as well while you're driving?
Yes, I do have.
Okay. Okay. All right. Do you have any other problems like any speech difficulties?
No.
Are you able to feel all the sensations?
Yes.
Any tingling sensation or numbness in your hands or feet?
No.
No. Okay. All right. Do you have any issues with your waterworks?
No.
Any issues with your bowel habits?
No.
No. Okay. All right. May I know if you have noticed any changes with your weight?
Yes, I gained weight.
You gain weight.
Yes, I
Can you
gained.
quantify that for me? How much you have gained over what period of time?
Maybe 4 kgs around 1 or 2 months or so.
4 kgs around 1 or 2 months?
Yes.
Okay. Any skin changes at all?
No.
No. Okay. Do you have any bone pains?
No.
Okay. Can I ask if you have any medical conditions like high blood pressure or high blood sugar levels?
I was said that I have high blood pressure,
Okay.
but I didn't bother about that.
Okay. So you never took any medications for that?
No.
Okay. Do you remember the value of your last blood pressure measurement?
No.
You don't remember? Okay.
No.
All right. Do you have any other medical problems apart from high blood pressure?
No.
Okay. Do you use any medications?
No.
Any over-the-counter medications?
No.
Are you allergic to any medications or food?
I don't think so.
You don't? Okay. All right. So may I know if you have undergone any surgeries or procedures in the past?
No.
No. Any similar issues running in the family?
I don't think so.
Okay. Any sudden deaths in the family?
No, not recently.
Okay. All right. Can I ask you some personal questions if that's okay?
Is it required? Is it relevant?
Yes, it is relevant. So,
Yeah.
okay. Do you smoke?
Yes.
Okay. Can you tell me how often and how many cigarettes per day?
Maybe 5 to 6 cigarettes a day.
Okay. Since how many years you've been smoking?
Maybe 10 to 15 years.
Okay. How about alcohol?
Occasionally.
Occasionally. How
Yeah.
often do you take? And what kind of alcohol do you take?
Maybe whiskey or something like that.
Okay.
Or once or twice a week.
Once or twice a week. See, I have to tell you that smoking and alcohol both are really harmful to your health and they might interact with certain medications that we are going to offer. So I would really request you to cut down both of them.
Okay.
Okay. And if you want any help, we can do that from our side. We have some cessation therapy as well. Okay. Thank you so much. I'm sorry to ask this, but it's relevant. Do you take any party drugs?
No.
No. Okay. Can I ask more about your family? Like, who do you live with? Okay. You stay with your wife and children, or
Yes.
you stay alone?
I stay with my wife.
Okay. Is there any issues with intimacy?
No.
Okay. What kind of job do you do?
I'm a driver basically.
Okay. What kind of vehicle do you drive?
I drive a truck.
Okay, since you've been having this bumping into objects, I would really request you to stop driving for the moment till we find out what's happening with you. Would
Then
that-
what will I do?
Okay, for that part, we can talk to the social services and we can get you some help.
Okay.
Okay, it's going to be for a brief period of time only. Once we know what is happening with you and treat your cause, we can definitely make sure that you can start again by informing to the DBLA.
Okay.
Okay, all right. So how are these symptoms impacting your day-to-day life?
I find it difficult to drive.
Okay,
Yeah.
so all right, we'll take care of that.
Okay.
Can I know how your mood has been lately?
It's been slightly on the lower side.
Okay, all right. So can I ask you a few questions? For most of them, the answer would be a no.
Okay.
Have you noticed any headache?
No.
No. How about any heart racing?
No.
Any shortness of breath?
No.
Any lumps or bumps in your body?
No.
Any raised body temperature?
No.
Okay. Any tummy pain at all?
No.
Okay. Have you noticed any leg swellings?
No.
Okay. Do you have any weather preference? Hot or cold intolerance?
No.
No.
Nothing like that.
Nothing like that. Okay. Do you have any neck swelling?
I haven't observed something like that.
Okay. All right. I would like to examine you. Meanwhile, if I find anything relevant, I would like to ask you questions also. Would that be okay?
Yeah.
Can you try to remove your shirt for me once?
Yeah.
Can you do this for me? Can you do this for me? Spread your fingers, please. Can you turn your hands over for me? You can relax. I'd like to check your pressure, pulse. At this point, I would like to offer to check blood pressure of the patient.
His blood pressure is 160/80.
160. Okay, thank you. So, can you open your mouth for me? Can you stick your tongue to the roof? Thank you. I'm going to pull your eyelids down. Can you look up for me? Can you please look down for me? I'm going to check your back once. Can you bend your neck a little bit? Do you have any bone pains? Any
No.
back pain?
No.
Okay, all right. Is your vision all right? Are you able to see my face clearly?
Yes.
Okay. I'd like to check your side vision now. So for that you need to look straight, keep your head still and let me know when you can see the red tip.
Okay.
Okay. Can you close your left eye with your left hand? Can you see it? Look
No.
straight please.
No.
Look straight. Now.
No. Yes.
Now.
No.
Now.
No. Yes.
Okay. Can you swap your hand for me? Can you see
No.
this?
No. Yes. No. No. Yes. 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 Yes.
Okay. Okay. All right. You can relax now. I'm going to. Can you please place your legs on the bedside for me? Okay. Now I'm going to check the strength in your muscles. Can you lift up your shoulders like this and don't let me push you up? Okay. You're not able to. Okay. Can you do it?
No.
Push it down?
Can't.
You can't. Okay. Okay. All right. Please look straight. I'm going to feel for lumps in your neck.
Okay.
Can you please lie down for me, sir? I'm going to listen to your chest. Do you have any pain in your feet?
No.
I'm going to gently press on them if that's
Okay.
okay.
No.
No pain. Okay. Can you just slightly lift up your trousers and see? Okay. All right. Can you please sit for me once again? Okay. By crossing your hands, can you try to stand up for me?
No.
It's difficult.
It's difficult for me.
Okay, all right. So I would like to offer fundoscopic examination at the end if time permits.
Okay.
I have few more questions to ask the patient.
You can proceed.
Okay. So have you noticed any change in the quality of your voice?
No.
Any cough?
No.
Okay. All right. Have you noticed that you're passing hard stools or blood in your stools anytime? No. Okay. Any issues like lumps or bumps in your body?
No.
Any night sweats?
No.
Okay. How is your appetite like?
It's fine.
It's fine. Have you noticed any joint pain specifically?
No.
Okay. All right. If I still have time, I'd like to auscultate his respiratory sounds.
You still have got 4.5 minutes.
4.5 minutes. Okay. Can you please take a deep breath for me in and out? Can you take a deep breath for me? Once again, please. Once again, please. Okay. So have you noticed any issues with your sleep?
It's fine.
Any snoring episodes anytime?
No.
You have got 2 minutes, doctor.
Okay. All right. Do you have any questions for me? Any concerns?
Yeah. Will I be able to work? Continue my job?
Okay. At this point of time, I would really request you to stop driving. Once we find out what is causing this vision problem for you, we can inform the DVLA, and once we treat the problem, I think it would be safe enough for you to drive back again once you are treated.
Is this curable?
To be honest with you, this is not an entirely reversible condition, but what we can do is we can try to manage it with the appropriate treatment. So we can refer you to the hormonal doctor, the gland doctor, and we will form a team of doctors where specialist nurses also will be involved in this, and we will be giving you some medications, and we have to do the appropriate tests first.
And I'm the sole breadwinner for my family.
Okay.
So
I understand there is a difficulty for you. Definitely we can refer you to the social services and give you the appropriate support as much as we can. How does that sound? Is it okay?
yeah.
Okay. Do you have any more questions for me?
No.
Okay. Thank you so much. And do you want me to get you?
Your time is up, doctor.
Yes.
Can you tell me your positive clinical findings in this patient, doctor?
Yes. So after examination, has a high BMI, and his pulse rate was normal. He had high blood pressure, which was 160/80, and on visual field examination, there was bitemporal hemianopia, as well as proximal myopathy, which was evident in the upper limbs and the lower limbs as well. Also, he had abdominal striae that I could appreciate. However, I didn't appreciate any systemic involvement, like cardiovascular and respiratory system examination was normal. Added to this, he had some skin changes in his lower limbs and pedal edema was present.
Any other clinical findings you found in this patient?
No.
Okay. If you had more time, what else examination you would have done in this patient?
I would have examined his abdomen, organomegaly, and I would have performed an entire cranial nerve examination if possible, like extraocular movements and visual acuity as well.
Okay. And what will be your differential based on the history and the positive findings you just gave me?
The differentials I would consider first would be Cushing's disease, followed by Cushing's syndrome. I would also like to rule out any ectopic Cushing's. However, this patient didn't have any signs of malignancy like liver cancer.
Why do you think this patient has got Cushing's disease?
Cushing's disease is because he has history and signs suggesting pituitary cause, and I could appreciate that he was having bitemporal hemianopia, which makes me think that it is secondary Cushing's first. And then because of the hypercortisolism, I am still considering Cushing's syndrome and ectopic Cushing's.
Okay. And how would you differentiate between the Cushing's disease and Cushing's syndrome?
Cushing's disease, the patient will have this pituitary involvement, vision involvement, and also there can be other hormonal deficiencies like hypothyroidism is a possibility or hyperprolactinemia. And Cushing's disease as such, the patient will be having symptoms of Cushing's syndrome alone with obesity and proximal myopathy. I would not expect vision difficulties in that patient.
What other differential diagnoses would you like to consider here?
I would like to rule out causes of high weight gain like hypothyroidism or complication of Cushing's with obstructive sleep apnea. And any iatrogenic Cushing's also I would like to rule out, although I didn't get anything positive from the patient.
Did this gentleman had any features of obstructive sleep apnea?
No. When I asked him about symptoms like snoring and sleep disturbances, it was not positive.
Okay. Investigations would you like to do in this gentleman?
Okay, investigations I would do it in two categories. First, to confirm the diagnosis, I would like to consider overnight dexamethasone suppression test. I would do late night salivary cortisol and 24-hour urinary cortisol as my screening test. If they are positive, then I will consider high dose dexamethasone suppression test with plasma ACTH measurement to know if it is primary or secondary cause. To rule out the complications, I would do a random blood sugar, HbA1c, postprandial blood sugar. I would examine his blood pressure in all the four limbs, and I would also request for serum urea and electrolytes to see if there is any hypokalemia.
Okay. Any other investigations would you like to consider here?
Yes, imaging scans also I would consider.
What imaging scans would you want to do here?
I would like to consider MRI of the brain focusing on the pituitary. And if I can't find a lesion over there, then we can offer inferior petrosal sinus sampling also.
Okay. Anything else you would want to do to look for any ectopic source?
Yes, I would consider chest X-ray and CT scan of the chest if possible.
And what you are looking here?
Here I'm looking for any small cell cancer evidence because Cushing's can be ectopic Cushing's is a paraneoplastic complication.
Can this gentleman has a possibility of having ectopic Cushing's?
It is still a possibility, but the patient should have weight loss ideally rather than weight gain if it is ectopic.
Alright. How do you manage this gentleman?
Management, I would do it in 3 steps. First, conservatively, I would talk about risk factor management like blood pressure and high blood sugar levels also I would check and manage that. And multidisciplinary team approach with specialist nurses, gland doctors, and treating the complications of Cushing's. Second step is medical management. I would offer agents like metyrapone or ketoconazole for the patient for the control of hypercorticolism, and medications for high blood pressure and diabetes as well. And the third step would be surgery, wherein we can perform transsphenoidal adenomectomy if the patient is having any pituitary microadenoma.
Okay. Would you consider any other medications in this patient?
Yes, dopamine agonists like cabergoline and bromocriptine can be given, and latest drug like a silodrostat can be offered to the patient.
Okay. One important skill in the clinical consultation is the communication skills. And the communication skills is based on your history taking. This candidate did really well when it comes to history taking, eliciting all the positive symptoms the patient had and also covering all the negative symptoms, which also included a systematic review of all the systems. This candidate did really well in covering all the elements of the history taking, like past medical history, any allergic history, any family history, occupation. But the candidate did miss to ask if the patient has traveled anywhere recently. Though it might not be relevant to your case, but it is important to cover all the important points that is required in history taking, because only then you will be marked on satisfactory. If you miss any of the points in the history taking skills, you might be marked borderline. And as given in your mark sheet, when it comes to examination, you need to be very focused and have a systematic approach, just like what our candidate did. When you know the diagnosis, when you have the differential diagnosis in your mind, it is important to follow a proper sequence that is in particular to that case. Like the candidate started with the hands, checking for the blood pressure, then going to the face, then checking for any lymph node enlargement, then going to the other system examinations like respiratory, cardiovascular, then abdomen, then finishing the examination with the legs. Meanwhile, the candidate also tried to offer the fundus examination. If you do not have enough time to do the fundus examination, you can simply offer it to your examiner that at this point of time I would like to offer the fundus examination. You would still be considered as satisfactory to take the patient's permission before you undress them, and also where to hand over the shirt back when you have finished your examination. This highlights the patient welfare and that you value the dignity and the safety of your patient. Based on the history and the clinical science, the candidate gave the right differential diagnosis for this case. And in the clinical judgment, the candidate considered all the necessary investigation in particular to this case, was knowledgeable about the treatment modalities that can be considered in this patient. And like the candidate did, it is always important to take the opinion of your senior doctors. Always involve the consultants in the decision making. And if you notice, the candidate finished this history taking and examination before 15 minutes. So whenever you come across where you are finishing your consultation before 15 minutes, make sure you utilize the remaining time in going through your history again to see if you have missed out on any of the important points, and also see if any extra test or the clinical examination that you can do on the patient. You can still utilize your time. But if you are confident enough that you have covered everything, you can start presenting your case.